Hi everybody, my name is Danica Cabrera and my partner's name is Renee Pacayo. We will be presenting on vaginal pessaries, which is a pelvic floor tool for women. So let's just get into an overview of what pessaries are. But let's tackle the problem first. What was the main reason why pessaries were invented in the first place? So pessaries actually have a long history in women's health and gynecological care. They were made to tackle the prevalence of issues such as pelvic organ prolapse, which recent studies have shown that 40% of women will experience some form or stage of pelvic organ prolapse. Another issue is urinary incontinence, as 25% of young women, 44 to 57% of middle-aged women, and 75% of elderly women were found to experience some sort of incontinence. Over time, pessaries have actually evolved to serve the prevalence of these issues. However, they were actually initially used as contraceptive devices in ancient times and were made of materials such as wool and stone. But luckily, times have developed, and now a vaginal pessary is a medical grade silicone or plastic, removable, and non-surgical device that is designed to be inserted into a woman's vagina. So its main function is to lift, support, and alleviate any discomfort of the internal pelvic floor organs a woman may have. Its function also includes being able to strengthen the muscles around the area, and as well as treat urinary incontinence or pelvic organ prolapse symptoms. Pessaries also come in different sizes and shapes, and they depend on the purpose of use of the patient as well as their anatomy. Let's move on to the various types of pessaries. So there are many different types of pessaries that are prescribed by physicians, again depending on the patient's anatomy as well as the symptoms they possess, as well as share to their physician or doctor during assessment. The most common type of pessary that is often prescribed is the ring, which treats mild to moderate pelvic organ prolapse and urinary incontinence. The ring is folded and gently inserted into the vagina, where it unfolds and rests against the vaginal walls and then supports the pelvic organs. Next is the Gyurung pessary, which treats cystocells, which is just the protrusion of the bladder, as well as rectocells, which is only the protrusion of the rectum. So in the same way, it is folded and inserted into the vagina, but it also straddles the bladder or the rectum, depending on what needs to be treated. Next is the Hodge pessary, which is used for mild cystocells. So this one is carefully placed into the woman's vagina, as it is for women with narrow pubic arches. And the multiple support arms and knobs on the pessary provide better support for the pelvic organs. Next is the Q pessary, which treats third-degree uterovaginal prolapse. It creates a suction between the vaginal wall, but this pessary has to be removed at night, unlike all the other pessaries where patients can leave them overnight. Next is the donut pessary, which treats severe stages of pelvic organ prolapse. The donut encircles the cervix or the vaginal apex, and its central opening allows for better drainage or air circulation. Lastly, the gel horn pessary, which treats severe pelvic organ prolapse. So, in the same way as the ring, it is also folded and gently placed into the vagina, but it is inserted in the vaginal canal with its bulbous end towards the cervix. So because the pessary devices come in a variety of shapes and sizes that are customized by medical professionals, they accommodate the pelvic floor anatomies of patients as well as treat pelvic organ prolapse and urinary incontinence. The best thing about pessaries are the cost effectiveness, and it is the best non-surgical option for patients who do not want to undergo surgery or do not even qualify as suitable for getting one. The device is also a great treatment that can be reversed for patients who have obtained the pessary device but do not see any sort of relief or improvement in their gynecological issue. And so if the pessary device doesn't work out, then they can always have it, just remove it and then go on to the next intervention that they think that would treat them best. However, some cons that may arise from the pessary, especially because it's being internally inserted into a patient, are complications of irritation, pressure sores, bleeding, as well as infections. So because they are a device that can be inserted and removed, proper maintenance has to be done. Abrasions may also arise because if the pessary wasn't properly fit and insufficient lubrication during insertion had happened.